Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation, and we are on the website, as you could see here, www.pcref.org, and I'm going to discuss the issue of decision-making and show you the model of decision-making as expressed by using an image of a pyramid. So let's start. So as you could see here on this page, we have all the components that I'm going to discuss. So let's look first at the pyramid itself. And I click here, we see the pyramid itself, and let's go over the questions that we are trying to answer. So at the bottom of the pyramid, we have the question, what information about prostate cancer treatment is available to me? On the second level, the question is, how can my doctor or coach or expert help me understand and prioritize this information? You have to understand the information, then prioritize, because then only you have to ask your own question. Why is the decision right for me? So as I mentioned, we have 3 levels here, and the sources are the public, then the physician, and then the patient itself. And as I said, here everybody participates, here you and your physician, and only you. So let's go and look at the process. The process itself is, on the first level, is to collect all the data, all the information, and to sort it out. This is mainly work done by you as a patient, although it would be nice if doctors will do the same in parallel, so they will be on the same page like you. But here you collect and sort all the information, and the information is available on the internet. On the second level, you have the understanding and prioritizing. Here you need the help of your physician, or better yet, a coach, which I define somebody who's not biased and who's not going to participate directly in your care, but who could have your interest in his heart and on his mind, and try to explain to you so you could prioritize. And then the decision is actually up to you. What are the goals? The goal is to get the information, to have the understanding, and then to have the wisdom of the application. So after many years of practicing this decision-making process, I came to the following conclusions. So here are my conclusions after many years of coaching patients. Using this model of decision-making, here are listed the main conclusions that I came to realize together with my patients. There are many options and opinions to choose from, and it's very important to know even whom to go and get the opinions from. And that's something that I explain to patients when they do coaching with me. Advice is tinted by the perspective of the advisor. This is very important because a surgeon will give you or be inclined to one type of advice. A radiation oncologist is inclined to give you another type of advice. And an oncologist who claims to be non-biased, as a matter of fact, is biased too, and that is reflected by the advice that he is going to give you. Ideally, you should have advice given by somebody who is not going to treat you, by somebody who has past history of choosing all the treatments, including alternative medicine and approaches to nutrition, and putting the patient more in the center of the decision-making. The next point, there are no guarantees. Your personal outcome may be very different from the statistical outcome you have read about. In other words, you are unique. So you have to be very careful. Dr. Eric Topol, in his recent book about the creative destructive of medicine, coined the term population medicine, which means we try to make a decision on individual care by looking at large group of patients and try to find an average what would be the best way to go, but we have to resort to the individualized medicine and really try to remember that the population medicine and all the studies are only a suggestion. I'm reminded of a very famous saying by a very famous guy who said, "First do no harm," Hippocrates. He said a sentence which is not being quoted enough, and that's why I bring it here. I hope the doctors and patients will quote it to themselves more often. What he says is, it's more important to know what kind of person has the disease than what kind of a disease that person has. I'll say it again. It's more important to know what type of patient has the disease, what kind of disease the patient has. We look at diseases but don't look at the patient himself, and every patient is unique and it's manifested by a different gene expression on each individual. So let's continue now. Often the disease has to be dealt with again and again over the lifespan of the patient. Unfortunately, you may not be able to cure it all at one time. That's a whole discussion for another time, what is the meaning of cure, but most patients have this expectation that if they only would know what is the right treatment and won't have to be treated again, then their problem will be solved. As a matter of fact, when I use the word treatment, I refer to the things that the doctor is doing, surgery, radiation, or whatever, but I would like to believe that the best term should be care. I do not treat diseases, I take care of human beings that are different in their biological makeup and different with their expectation and their psychological makeup. Let's continue. Partnership has to exist between the patient and the physician. That's difficult nowadays because there is preloaded prejudice of the patient against the doctor, and I would say also doctors are prejudiced against the patients, being scared about patients that bring all this information from the internet, and the patient is suspicious of the doctors as a group, although I'm always reminded that patients always say, "Oh, doctors are bad, but my own doctor is good." And everybody says it. So I assume that all the doctors are good for their individual patients, but you have to create that partnership, and you need time for that. And unfortunately, many doctors don't have enough time allocated during a visit. So perhaps that's another topic for discussion another time, how to increase the bond between you and your doctor and make it more a relationship and not just somebody, a number on an assembly line. Let's continue. The physician is the coach, but the patient is the one that has to carry the game. And I'm saying that because the patient has to make the decision, because we as doctors don't have the right answer every single time, and the patient has to feel that whatever decision he makes, he participates in the decision and he has to involve directly in the decision for the only reason that if the treatment will not work, the patient will not be angry and disappointed of his doctor, but if he knows that he participated in the decision, he will say, "Okay, I tried this way, it didn't work, let me try something else." Because there is nothing more destructive for a patient with a disease is to be angry at the doctor and the results of a treatment. Instead, I would rather have the patient an attitude. We tried one treatment that did whatever it did for trying to control the cancer. Let's try and find another treatment. But again, the physician is the coach and the patient is the player. That means the patient is a player. He's the one that will get the bruises on the field where the game is played, and he has to pay the prices for all the side effects. So while patients are focusing on the prize with the letter Z, the prize, I think you always have to keep in mind what is the price with the letter C, what is the price that the patient has to pay. Let's continue with our conclusions. Personal participation is essential in your own life decision. And I just repeated it before, I'll say it again, but it's a very important point. The next point, it's extremely important, is interject your philosophy of life, your own wisdom, how to apply information into making the decision. You have to trust yourself that you have it within yourself, the ability to make your own decision. Even if it's not the right one, it will be your own decision. You will live with it, and you'll have a chance to take another course of action in case that decision did not bring you into the correct path. I wish you good luck with this process, and I hope that our website can help you. My coaching services are available. I'm doing the coaching for the foundation, so I'm not in private practice. I just try to help patients to find their way when they are at the crossroad. And for some reason, people think that this happens only with the initial decision, but that happens all along the way, that sometimes you need somebody who has your interest at heart, who is not involved in your daily care, to try to give you another perspective. That doesn't mean that you give up your doctors. You work with your doctors, but because of lack of time, and if your doctor could not fulfill the role of a coach, then I think that looking at coaching is a very important point. You could learn more about our coaching services by going on our website, www.pcref.org. I wish you the best. Stay well, stay informed, and have fun. And if you have any question, call us. The numbers and the email address will be on the screen. Thank you. Goodbye.